Welcome to Part 2 of Module 2. In this lecture, you will learn the anatomy of the skull, which forms most of the bones of the head, including the hyoid apparatus. The skull is not a single bone, but is composed of several flat bones. It can be divided into a cranial part or brain case and a facial part. The cranial part surrounds the brain and is composed of the following bones: occipital, frontal, parietal, temporal, ethmoid, and sphenoid bone. The facial part surrounds the face and protects some structures of the digestive and respiratory system. It includes the maxilla, incisive, nasal, palatine, pterygoid, zygomatic, and the lacrimal bone. Let us begin with the bones of the cranium. Here is a caudal view of the skull. Let us start by discussing the back door of the skull, which is the occipital bone. The occipital bone is an unpaired bone and is the most caudal bone of the skull. It contains the foramen magnum, through which spinal cord passes through. On the either side is a pair of bony prominences, the occipital condyle, which articulates with the atlas. Lateral to the condyles are the pointed jugular or paracondylar processes. The external occipital protuberance is the caudal process of the occipital bone. It can be palpated in a live dog. Here is a lateral view of the skull. Frontal bone is a paired bone that forms the rostral part of the roof of the cranial cavity, as shown here. At the frontal bone, you can see a pointed structure that partly forms the orbit. This is called the zygomatic process of the frontal bone. Another view of the skull, this time a dorsal view showing the paired frontal bone. Next bone of the cranium is the parietal bone. This is a paired bone that, together with the frontal bone, forms the roof of the cranial cavity. The right and left halves of the parietal bone and the occipital bone meet at the dorsal midline to form the external sagittal crest. Next is the temporal bone. This is a paired bone that lies below the parietal bone on the caudolateral surface of the skull. The most ventral part of the bone forms a rounded prominence called the tympanic bulla, which houses the structures of the middle ear. The external acoustic meatus is a large opening at the tympanic bulla. This is where the external ear is attached. In a living animal, this opening is being covered by the eardrum or the tympanic membrane. The temporal bone has an elongated bony projection called the zygomatic process of the temporal bone. Together with the counterpart process in the zygomatic bone, they formed the zygomatic arc. The temporal fossa is a depression formed by the temporal and the parietal bone. Next bone is the ethmoid bone. To visualize the ethmoid bone, a sagittal section of the skull is a must. Here is a lateral view of a longitudinally sectioned skull. And here is the ethmoid bone. This is an unpaired wedge-shaped bone that forms the rostral wall of the cranial cavity. To complete the bones of the cranium, we need to check the skull at a ventral view to visualize the sphenoid bone. This unpaired bone lies at the ventral aspect of the skull, forming the floor of the cranial cavity. The sphenoid complex is divided into a narrow and smaller pre-sphenoid and a bigger basisphenoid with two irregular wings. The sphenoid bone houses the pituitary gland via a depression called sella turcica. Let us start discussing the bones of the facial part of the skull. Again, here is a lateral view of the skull. The largest bone covering the lateral wall of the face is the paired maxilla or maxillary bone. The maxilla supports the canine and cheek teeth of the upper dental arcade. The maxilla also features a large infraorbital foramen, which appears dorsal to the third premolar. The maxilla also forms a major part of the hard palate, as you can see on the second figure. Rostral to the maxilla is the incisive bone. This paired bone is the most rostral bone of the skull and even of the body. Each incisive bone supports the incisors of the upper dental arcade. Here is a dorsal and ventral view of the skull showing the incisive bone. The two openings are called palatine fissure. Note that the incisive bone is one of the bones that form the hard palate. Other facial bone that forms the hard palate is the palatine bone. It can be seen on a lateral view of the skull like this, but it can be best viewed ventrally as shown here. At the border between the maxilla and the palatine bone, there are paired foramen called the major palatine foramen. At the palatine bone itself is a smaller paired foramen called the minor palatine foramen. Dorsal to the incisive bone is the nasal bone. This paired bone can be seen better at a dorsal view of the skull. This longitudinal bone forms the roof of the nasal cavity. Caudal to the maxilla is the zygomatic bone. This bone is also known as jugal or malar bone. This paired bone forms the ventrolateral part of the orbit. The caudal end of the bone forms a projection called the temporal process of the zygomatic bone. Together with the zygomatic process of the temporal bone previously discussed, they formed the zygomatic arc. The combined width of the zygomatic arches on a given skull indicates the biting strength of a dog, as the masticatory muscles lie within the arches. Next bone is a small, irregularly shaped lacrimal bone. This paired bone lies at the medial surface of the orbit. The orbit is the bony socket holding the eye. The lacrimal bone can be seen better at a cranial view as shown here. Note that the orbit of a dog is incomplete and only being completed in a live animal by an orbital ligament. Pterygoid bones are small, thin plates of bone. They form part of the lateral wall of the air passageway dorsal to the soft palate. This paired bone is mostly seen at a ventral view of a skull. They are identified by the hook-like structure called humulus. Vomer is a gutter-shaped bone that longitudinally separates the right and left nasal passages. They can be seen at a cranial and ventral view of the skull. The skull is studded with numerous foramina for the passage of blood vessels and nerves of the head. Here is a schematic figure of a skull with the zygomatic arc removed for better visualization of some foramina. The same figure is present at the module provided, and you are encouraged to identify the foramina, including to which bone it can be located. A detailed discussion on the foramina will be provided in the lab class. Now let's move to discuss the lower jaw bone or the mandible. Mandible is composed of two halves or dentaries joined at the chin by a cartilaginous joint called the mandibular symphysis. It carries sockets or alveoli for the teeth of the lower jaw. The body is a horizontal part bearing the lower incisor, canine, premolar, and molar teeth. The ramus is the vertical part bearing no teeth. At the ramus, we can see three bony processes. The coronoid process forms dorsal half of the ramus of the mandible. The condylar process or articular process is a shorter process which articulates with the temporal bone to form the temporomandibular joint. The angular process is a hooked eminence ventral to the condylar process. This is unique in carnivores like dogs and cats. There is also a deep masseteric fossa in dog. This is a depression at the ramus of the mandible for the insertion of the masseter muscle. Mandible also have foramina. Mental foramen is the rostral opening of the mandibular canal. There are three mental foramina and they can be seen laterally. Mandibular foramen is another opening, but it can only be seen at the medial side of the ramus. The hyoid apparatus lies at the intermandibular space and consists of a number of fine bones and cartilages. All are paired except for the basihyoid. Primarily, this hyoid apparatus holds the larynx and tongue in place. For orientation purposes, please note that the animal is facing in this position and the head and tail is located as shown. Let's begin with the stylohyoid. This is the largest and often called the great cornua. It articulates rostrally with the epihyoid and the temporal bone caudally. The next is the epihyoid, which is a small rounded bone situated between the stylohyoid and the ceratohyoid. It is also known as the middle cornua. Ceratohyoid is located between the epihyoid and the basihyoid. It is often referred to as the small cornua. The basihyoid is the only unpaired bone and is considered as the base. It is short and flattened and lies in a transverse plane. Please refer to this image to imagine the position of the basihyoid. Lastly, the thyrohyoid articulates caudally with the rostral cornua of the thyroid cartilage of the larynx. This is the laryngeal cartilage. For memory guide, you may use this acronym provided by Pasquini to help you enumerate the order and position of the bones of the hyoid apparatus. Sick elephants can be treated. This ends the Part 2 lecture of this module. I hope you are now familiar with the different bones of the head like the skull, mandible, and the hyoid apparatus. A short quiz for Part 1 and Part 2 of this module is prepared for you to answer. After that, you may now proceed to Part 3 of Module 2, which is focused on other axial skeleton like vertebrae, ribs, and sternebrae.